First thing Monday morning, Pfizer announced its COVID shot works for children 5 to 11 years old. More than 2,200 kindergartners and elementary school age kids got the 2 shots as part of Pfizer's study. The dosage was much lower. This age group only got a third of the amount of vaccine that people 12 years and older are getting. And according to Pfizer, the 5 to 11-year-olds still developed coronavirus-fighting antibody levels just as strong as teens and young adults. And they experienced similar temporary side effects like sore arms.
We've been waiting for this news from Pfizer for a while now. Of course, it's not the end of the process.
There are several steps that have to happen before these shots can be given to any 5 to 11-year-old. Pfizer will show the data from their clinical trials to federal regulators. The company plans to apply to the FDA for emergency use authorization by the end of the month. The FDA's independent advisory committee will review the information for the FDA to approve. Similarly, another independent committee reviews the information for the CDC to weigh in. And once it goes through both the FDA and the CDC, then it can be given to the public. Parents with 5 to 11-year-old kids, like Tarrant County mom Natalie Ramsey, understandably have a lot of questions about Pfizer's announcement.
Have they done enough research to see what the long-term effects are going to be in 1 year, 2 years, 3 years?
We have never seen a vaccine that produces, unseen effects years down the road. The children that were enrolled in the original trials will continue to be followed for some period of time, but we have no reason to believe that there are going to be any unforeseen side effects.
And then how is it going to affect their overall immune system?
As far as we know, the only effects on the immune system are the additional protection it provides against getting COVID.
And finally, many parents want to know about timing. When can their 5 to 11-year-olds get a shot?
We're hoping that by the end of October or early November, it'll happen as soon as it gets the blessing of the FDA.
In Frisco, I'm Muriel Placencia.
And meantime, the topic of COVID booster shots heads to the CDC this week. An independent advisory panel will weigh in. The CDC director will then formally sign off on the recommendations. Now, last Friday, an FDA advisory panel rejected Pfizer's request to offer a third shot to the general public. That panel did recommend a booster for people 65 and older, as well as the high-risk immunocompromised. Now, the CDC released data that shows the Pfizer vaccine's effectiveness drops significantly 4 months after vaccination. The study, based on 3,700 patients, found the vaccine was 91% effective initially, but dropped to 77% efficacy. The study found the Moderna vaccine did not have the same rate of decline. The study did not have enough data to similarly evaluate the Johnson & Johnson vaccine.